This webinar is being recorded, and the recording will be made available within a week. The format will be presentations and slides by our panelists, followed by a moderated question and answer session. All participants will be muted for the duration of the webinar. And if you have a question that comes up during the presentation, please enter it into the Q&A box, which should be at the bottom of your Zoom screen, and we'll add it to the list and hopefully answer it during the question and answer portion of the webinar after the presentations. So to kind of start things off before I pass it to our experts, lately there's been a lot of noise about vaccinations in the news, actions that have been taken by individual states and at the federal level has led to the spread of misinformation and a greater reluctance to get immunized. And while there are factions that welcome this, there has been significant pushback at the state level and by Congress. Just a couple of the headlines that we've been seeing, over the past couple of months that have kind of led to this misinformation. But the upshot is that the public remains confused and trust in public health agencies and vaccines is very low. So now I want to introduce today's speakers. The good news is that we have with us today 3 very experienced and highly credible speakers who can share with us the latest information on how Illinois is addressing vaccines in 2025. Respiratory Health Association, we do our best to only put out accurate and updated information, and these are the people that we turn to for that information. So first, I'd like to introduce Dr. Jennifer Seo. She is a pediatric medicine medical advisor at the Illinois Department of Public Health. She is the former chief medical officer of the Chicago Department of Public Health. Dr. Seo is board certified in internal medicine and pediatrics. She received her medical degree from Vanderbilt University School of Medicine and her law degree from Columbia Law School. She completed her internal medicine pediatrics residency training at the University of Chicago. Next, I'd like to introduce Dr. Alexander Sloboda from the Chicago Department of Public Health, who will be our second speaker today. Dr. Sloboda is a licensed emergency medicine physician and public health leader. He has previously worked as an emergency medicine physician and faculty at Columbia University Medical Center and Rush University Medical Center. He is currently the medical director of immunization and emergency preparedness programs for the Chicago Department of Public Health. During his time at CDPH, he has led operations for CDPH's New Arrivals Response and the City of Chicago's Measles Outbreak Response. Dr. Sloboda also completed a fellowship in global emergency medicine and has been working with partners in Ghana and Nigeria for over a decade in developing EMS systems, emergency medicine capacity, and emergency medicine training. He has also developed and led high school mentorship and pipeline programs, as well as emergency department and community initiatives for trauma-informed care and violence prevention. Dr. Sloboda is a passionate advocate for health equity, social justice, and universal health care. And lastly, I would like to introduce Jenny Pinkwater, who is the Chief Executive Officer of the Illinois chapter of the American Academy of Pediatrics. Jenny has served as the CEO of the Illinois chapter of the American Academy of Pediatrics since 2015. She provides strategic direction to support the organization's 2,000 pediatrician members to improve the health and well-being of children and families in Illinois. Jenny oversees a dynamic grant-funded nonprofit organization focused on education and advocacy to support optimal pediatric healthcare in Illinois. Since joining the chapter in 2008 as a project director, she has directed the policy and advocacy activities for the chapter, including the passage of child and family-friendly legislation and advocating for policy changes to improve healthcare quality and access for children and families. Dr. Seo will lead us off today talking about recent trends in vaccinations and vaccine-preventable conditions. And she'll also speak later about the state's policy response to recent events. So Dr. Seo, I'm going to hand it off to you, but I will be controlling the slides. So just let me know when you want me to go to the next slide.
Great, sounds good. And thank you everyone for joining us today. I will kick us off by going over some Illinois data on vaccine-preventable respiratory diseases. Next slide. So every year, the CDC puts out a prediction about what the respiratory season is going to look like. So what did they predict for this current respiratory season that we just started? So they said that when compared to last year, in terms of the peak weekly hospitalization rate, they are expecting the rates this year to be similar to last year. And when they break it down by each of the various viruses, for COVID-19, they are expecting season that is similar to or higher than what we saw last year in terms of peak hospitalization rates. Influenza, flu, they're expecting it to be lower. This is in part because last season was a particularly severe season, and I'll go into a little bit more detail on that. But they said that they have typically not seen two back-to-back super severe seasons, so they are predicting that this season is going to be severe than last season. And then for RSV, they're expecting it to be about similar to where we were last year. Next slide. And I just wanted to remind all of you that we actually have our own Illinois State Respiratory Illness Dashboard. It is updated weekly. You can follow along again for each of the different viruses, COVID-19, flu, RSV. You can look at emergency department visits, hospitalizations broken down by ages. Right now, in terms of regional data, is broken down by our IDPH public health regions. But you can kind of get more information for your particular area, follow along during the season and make any changes to your particular, if you are a healthcare provider, your clinical settings, if you are in the community, working with the communities to make sure that we are preventing these illnesses. Now, I will point out that you can see on the left, the grayed out Illinois state map says that there's no data because of the federal shutdown. I noticed that actually as of this morning, it seems to be back up. We're at a very low level right now. But again, we have started respiratory virus season, so we are expecting these numbers to go. We tend to peak around the end of December, early January, just something to keep in mind. Next slide, please. So as I mentioned, last season was a particularly severe influenza season. And one reason we know that is because we saw an incredibly high number of pediatric deaths. The reason why I'm pointing out pediatric deaths is because this is what is reportable to the state. So here in the state of Illinois, we saw 12 pediatric flu deaths. That's compared to 7 last year. This is the highest number that we have seen if you go back to pre-pandemic years to 2017, 2018. Nationally, we saw 280 pediatric deaths, and that was the highest number that we have seen since this became reportable in 2004. So really, really severe season last year. In terms of RSV, you can see we had 6 pediatric deaths. This last season was the first time that we received this data, so we'll continue to follow along and keep you all informed. And then in terms of coded pediatric deaths, we saw 3. So again, a very, very severe influenza season last year, so we want to make sure everyone gets vaccinated this season so that we don't see something similar. Next slide, please. So there's been a lot of focus on COVID-19 with the changing federal vaccine policies around COVID-19. So I'm going to give you a little bit more information about COVID-19 in particular. So here in the state of Illinois, again, kind of following national trends in terms of hospitalizations, the highest percent of hospital admissions for COVID-19 have been highest for adults 65 years and older. So that is the light blue line. And then also for children under the age of 2 years. That's the orange line right there. And you can see that in recent months, like in the summer, and again, we saw this nationally as well, actually that younger age group had higher hospitalization rates than our older adults. So again, very important as you kind of think about the vaccine recommendations that have come out around COVID-19. Next slide. And then the other thing is we know the vaccine is effective, but unfortunately, many people have chosen not to get vaccinated. And when we looked at our Illinois hospitalized children who were hospitalized for COVID-19, over 90% of them had no record of any COVID-19 vaccination. So again, as I just showed you, especially the younger children, those under age 2 years, really important that they get vaccinated because they do have severe COVID outcomes. They get hospitalized, and we want to prevent that. Next slide, please. So the other thing I just wanted to remind everyone of is that we do track our COVID and flu vaccinations here in Illinois publicly. So there is a dashboard that you can access and you can follow along. One thing I will point out is that for flu vaccinations, not everyone is required to report that into our state immunization registry, which is called iCare. So this is just what was reported. We know that not everyone is reporting. For COVID-19, there is still a mandate, a law in place that says that every vaccine provider is supposed to be reporting those COVID-19 vaccinations to iCare. But you can see the numbers are relatively low when you look here. What I will say is that there is a separate immunization data system called the National Immunization Survey that CDC runs. This is, they call households, they get information on vaccinations. Those numbers tend to be higher, usually for all vaccinations. So when we look at COVID-19, for example, for children, the National Immunization Survey saw that 16.5% of Illinois children last season had received a COVID-19 vaccine, 27% of adults. This is higher than the national rates. Same thing for flu. So for both children and adults, the National Immunization Survey found that about 50% of Illinois children and adults had received the flu vaccine. And again, this is higher than the national percentage. So lots of work to still be done there. But again, I wanted to make sure that you all were aware that this dashboard exists so you can help follow along in your unique settings and your communities. We don't have a dashboard for RSV coverage, but what I can tell you, again, this is all from iCare, and this data you can actually find on the CDC's website. About a third of infants under the age of 8 months had a reported RSV immunization documented, and then when we looked at older adults, 75 and older, it was about 30% too. So again, these are numbers that we want to increase because we have a very effective immunization now for infants, effective vaccines for adults and pregnant people, and so I want to make sure that the public and the community are aware of all these vaccinations and way to prevent disease. Next slide, please. So again, I'm just pointing out that we do have all of these dashboards, and I'm going to go into the school coverage dashboard a little bit more. It's all on our website. Actually have a new Illinois Head Start vaccination coverage dashboard. I will say that this is more broad strokes because they're only required to report whether a child is up to date or not, period. And so it doesn't break it down by individual vaccines. So if a child is missing one childhood recommended vaccine, they'll be considered not vaccinated. But again, I think a really useful tool, in particular for our Head Start partners and our early childhood partners, to kind of see what's going on in your different areas. Next slide, please. So over the last year, we heard a lot about measles. And so I'm going to be using measles as an example for some of our vaccination coverage rates. These are two maps. So on the left, you see our Illinois measles cases. We've had a total of 12 cases, down in our very southern region, and then cases in the Cook County area. And then you can kind of compare that to the school vaccination coverage on the right. So this is the percentage of children in schools across Illinois that have had a measles vaccine. And this is 2 vaccinations because we're looking at those who are 4 years and older, and it's required for kindergarten entry. So the blue area, so this is broken down by county. The blue areas are areas that have vaccination percentage of 96% or higher. So they're in a good place. Yellow is between like 91 and 96, and then red is under 91%. So lower vaccination rates that really put the county or school at increased risk of having a measles outbreak. And so you can see the southern area has lower coverage rates. And so we did a lot of work to try to bring those up. But again, I think a good tool for communities to use and follow along to see like, how is my community doing in terms of vaccination rates? Next slide, please. So when we look at the measles vaccination rates overall, and this is a similar trend that's been seen nationwide and for all of our childhood vaccinations, steady decline over several years over the last decade, and in particular starting in that 2017 to 2018 school year. This last school year, we saw a little bit of a evening out, a plateau for measles vaccinations. It was about the same as last year. So we are carefully watching that. It's October 14th. Everything is due tomorrow, October 15th, in terms of school immunization records, physical forms. And so we'll be able to see closer to the spring, early spring, how we did this past school year. But again, something that we've been watching because vaccination rates have been declining. Next slide, please. And I think the important thing is the measles vaccine in particular, right? The 2 doses should be done by the time a child is 6 years old, right? That second dose is due between the ages of 4 to 6, and it's required for kindergarten entry. Illinois has been under the United States average for kindergarten MMR vaccination rates. So we never want to be below average. So we have some work to do there. I will say, compared to last school year, we did have a slight increase. So we're cautiously optimistic that maybe this means that the trend's going to be turning around. But that early childhood period is so important. So for those of you who are joining us and who work in that early childhood space, a really important group that we want to continue working on. Next slide, please. All right, so I'm also going to talk about pertussis because we heard a lot about measles, but you may have also heard in the news that we had a few child deaths related to pertussis or whooping cough. This is something that is preventable. No child, no baby from pertussis. And this is just showing our case counts by year here in Illinois. You can see that we saw a big rise like we did in the nationally in 2024. 2025, it's a lower bar in particular because we're still collecting data, and this is data as of August of this year. But when we were looking at where we were, in 2024, August 2024 compared to August 2025, it seemed like we were at a lower count, which is a good thing. But again, I think this kind of goes along with the trend where we've been seeing lower vaccination rates. Yeah, so if you look at the DTaP, oh, yeah, go ahead, next slide, please. That was perfect. So when we look at the DTaP vaccination rates, again, trending down, but we've actually been remaining above the goal of 95% for DTaP. And the next slide, please. When we look at Tdap, right, children, when they turn 11, 12, they should be getting Tdap. It's required for 6th grade entry. The good news is we've seen a slow increase, it looks like, compared to last year in particular, but we still remain below our goal of having 95% of all school-age children in Illinois vaccinated against pertussis through Tdap when they're in that middle school age. So again, some things to keep in mind, especially because we have seen a rise in these vaccine-preventable illnesses. Next slide, please. And then before I turn it over to my colleague, Dr. Sloboda, I just wanted to end by giving you some insights into some of the barriers that we have heard from schools in terms of what they are seeing. And this was particular to measles, because we did a survey in spring. We wanted to make sure schools are ready because we were starting to see cases nationwide and in our own state. And so the schools that responded to our survey, you can see that the highest percentage mentioned religious objections or religious exemptions were a cause of lower vaccination rates in their particular schools. But you can see that there's a whole host of other reasons: concerns about vaccine efficacy, safety, lack of access, timely access to healthcare clinics, difficulty with enforcing the requirements. So a lot of different reasons, but I think it is striking that religious exemptions was a very high cause, actually the #1 barrier that was identified by our schools in terms of why they may have lower measles vaccination rates. Next slide, please. And this aligns with what we are seeing in our state here too. So if you go to our school vaccination coverage dashboard, it does have data on exemptions. And we have seen a rise in non-medical exemptions, meaning, and in particular, religious exemptions. So this also, you can see in red, the red bars are children who have medical reasons for needing an exemption. And then the blue are approved schedules, maybe their healthcare provider. There's a reason why the child can't get that vaccine right now, but could get it later. But you can see that green bar has been steadily increasing. And so I think this all speaks to why we're here today too, to talk about how we can increase vaccine confidence, talk about vaccines in our communities to really increase the rates of vaccinations in Illinois, because these are all preventable diseases, and vaccinations are a public health innovation that we really need to be taking advantage of. So with that, I'm going to pass it over to Dr. Sloboda.
All right, thank you, Dr. Sa. So I'm Dr. Alex Sloboda, Medical Director of Immunizations Emergency Preparedness at Chicago Department of Public Health. And I'm going to the best of my ability, try to explain what's been going on with ACIP over the last several months. Slide. All right. And sorry, there's a slight mistake. It's supposed to be Advisory Committee on Immunization Practices, but For those that are not as aware of ACIP, I'm just going to give a brief background of what it even is and how long it's been around for. So the Advisory Committee on Immunization Practices is an advisory committee at the CDC. It's been in existence for over 60 years now. It's a federal advisory committee, and they are tasked with developing recommendations on the use of vaccines in the civilian population for the United States. So they're a group of experts that traditionally will get together several times a year, review evidence, create recommendations if there needs to be any annual recommendations or any changes, and then that usually sets both the adult and childhood immunization schedules that the CDC then adopts for the country. Particularly why this is important is that not only does this set the immunization recommendations for the entire country, it also directly impacts what is covered by programs like Vaccines for Children, which I'll get into a bit more, Medicaid, as well as kind of sets the bar for what private insurance plans should cover. Next slide. All right, so the HHS Secretary does select the members of ACIP. They typically serve up to 4-year terms. Traditionally, they undergo a pretty significant vetting process before even becoming a member. Sometimes it can even take up to a year for someone to undergo vetting to make sure that they have the experience, the knowledge to do this work, as well as evaluate for any ethical concerns or conflicts of interest. Traditionally, they use a very transparent and rigorous process and frameworks to evaluate strength of scientific evidence. So if there's new evidence that comes out, whether it's study or data from the CDC, they have a whole framework that they'll use to evaluate that evidence and grade it. And from there, they can decide, based on the strength of the evidence, if there needs to be any changes to vaccine recommendations. Typically, people selected to be members of ACIP are knowledgeable in the fields of immunization practices and public health, experts in vaccines, immunobiological agents, in clinical practice or preventative medicine, also experts in clinical and laboratory vaccine research, and expertise in assessing vaccine efficacy and safety, which is one of their main roles. Next slide. All right, so where more people started hearing about ACIP this year, as many of you may remember have heard, is in June, the HHS Secretary removed all 17 city members of ACIP. And then on June 11th, a couple days later, the HHS Secretary announced 8 new members to ACIP, and then there's been several additions since then, and these were all hand-selected by HHS Secretary RFK Jr. Next slide. So we've already seen this new group of ACIP members meet several times this year. They've met in June and September and have discussed various different vaccine topics. Per usual, they talked about RSV, COVID-19, influenza, vaccine recommendations as we enter the fall. They also discussed chikungunya vaccine, and then recently as well talked about the MMRV vaccine, which is the measles, mumps, and rubella and varicella combination vaccine. And they started to discuss and potentially vote on hepatitis B, but postponed it for a future meeting. I'll start to get into a bit, obviously, about COVID-19 vaccine and a little bit about flu and MMRV, what they voted on. But I did want to highlight that they are assessing making changes to the hepatitis B vaccine schedule, which is concerning because hepatitis B vaccine for newborns and infants has been extremely important in reducing the hepatitis B infections, acute infections, chronic infections, cancer in childhood in the United States, and making any significant changes, really particularly not based on any evidence, to those recommendations could have significant impacts to hepatitis B prevention in the US. Next slide. All right. Do you want to, before we start talking about COVID-19 vaccine and ACIP, I do want to mention FDA, because that was the first step. The FDA does need to approve a vaccine and develop and generate a license and label for it prior to ACIP being able to give any recommendations for it. And so for the 2025-26 COVID-19 vaccines, late summer, FDA did approve those, but as many of you have probably heard, they put in specific language, particularly those under 65, and requiring at least one underlying condition in order to be eligible under the FDA label. And so you can see on the right, it's a little blurry, but this is the most recent 2025 CDC list of those underlying conditions that put people at an increased risk of severe COVID-19 infection. So there's very many different medical conditions, but there's other conditions such as physical inactivity, obesity, mental health conditions like depression that are included in that as well. You can also note that pregnancy is on that list as well, as it's obviously pregnancy is a condition that does put you at high risk for severe COVID-19 infection. That's been proven, and we've been seeing that for a long time now. So it is essential that people, while they're pregnant, are staying up to date on their COVID-19 vaccination so they don't have any complications in pregnancy and can pass on some immunity to their newborn infant once that occurs. The other kind of concerning part is that it was not really clear how they came to these distinctions for the FDA label. There was an op-ed published in the New England Journal of Medicine. There's a link there where FDA leaders had a couple pages about kind of going through their reasoning of why there needs to be a risk-based approach to COVID-19 vaccine in the US. And this is something experts have been talking about for a while, but it's kind of jumping straight from an op-ed article to FDA label without any clear kind of process being illustrated between that is a bit concerning. Next slide. All right, so we do have the FDA label. It is what it is. It does put up some barriers, obviously, as we've seen for people that are not, do not maybe land specifically in those underlying condition groups. So a couple of weeks ago, ACIP did meet to discuss their 25-26 COVID-19 vaccine recommendations. They voted on several different things. I'll kind of go through them kind of out of order to kind of make sense of them. This one that they voted on is basically their recommendations for COVID-19 vaccine for this season, really using this shared clinical decision-making model, a bit more straightforward for adults 65 and older, but still not straightforward. We recommend these people get vaccinated, but saying that it's based on individual-based decision-making. From 6 months to 64 years, it gets a bit more wordy in terms of still using individual-based decision-making model, but a lot more emphasis on risk-benefit analysis. So not the most straightforward recommendation. It can be even hard for providers to figure out what they're really going for, but at least somewhat kind of leaves open the door for people that want to get vaccinated being able to get vaccinated. Next slide. One thing that they did vote on that thankfully did not pass, it was tied and it had a tie-breaking vote by the work group chair, would be recommending that state and local jurisdictions should require prescription for the administration of a COVID-19 vaccine. This is typically not a type of recommendation that ACIP provides in the past, and it's unclear what kind of ramifications of this would be. So thankfully it did not pass, but again, could put up significant barriers to people getting COVID-19 vaccine if they were required for prescription. Probably it'd be up to the state or local jurisdiction at the end of the day, but still kind of concerning. Next slide. And then the other two parts of their recommendations that did pass, and we're really focused on the VIS and kind of the information provided to parents and guardians and patients that receive COVID-19 vaccine, and kind of really highlighting this informed consent process. In terms of, obviously, we're particularly healthcare providers, we're very familiar with informed consent process. It's something we do every day, talk to patients about why they should or should not get this procedure or medication or vaccine, and then also describing what the risks are. So this doesn't necessarily anything out of the ordinary, but it's they really want to emphasize it. One thing we'll have to see how it plays out is this 6 risk and uncertainties included in the work group chair presentation. This still hasn't really been written out in the website or policy. The presentation is now available online from Professor Levy, who's the working group chair. Covers a lot of different things. Obviously, big focus was pericarditis and myocarditis, the slight increased risk for younger adults or adolescent males. But this is something we've known for quite a while, and something we obviously discuss with patients in those groups. But also got into uncertainties around just mRNA vaccines, around pregnancy, something that they now call post-vaccine syndrome, and things like that, and really not providing super clear evidence of these potential really uncertainties is kind of the new term that's being used to describe these things, where you don't really need to provide a lot of evidence to say something. You're just, oh, we're uncertain about this, so we're just going to throw it in there. So obviously a lot of this is causing a lot of confusion, but these were the other votes that they did pass. And so we'll see, based on their websites and the VIS that they put out for COVID-19 vaccine, what that says. Next slide. So that's COVID-19 vaccine, and Dr. Suh and Jenny Pinkwater will get into kind of what are the recommendations from AAP and the state of Illinois for COVID-19 vaccine, but I just wanted to share what they were for from ACIP, kind of where we're starting from. Did want to cover influenza vaccine recommendations as well. Thankfully, a bit more straightforward, universal, everyone 6 months and older. I did want to highlight that they did specifically outline free of thimerosal for flu vaccines. So a little background: thimerosal is an ethyl mercury-based preservative used in multi-dose vials to prevent contamination. Largely phased out of vaccine supply of any types of vaccines in the United States. The only vaccine that really still contained in the US were the flu vaccine multi-dose vials, and that was to prevent contamination. But most of the supply has already turned to these kind of single dose syringes. But it's a little concerning that they pointed this out without providing any really new evidence that this is a concern, because as you can see, multiple studies have demonstrated that thimerosal, which is the ethyl mercury-based preservative, does not pose any health risk, and that it is an ingredient that has largely been phased out from vaccines in the US despite no evidence that it causes any neurodevelopmental problems. Put some links in there of a really good summary of all the evidence that looks at if there are any risks from using thimerosal as a vaccine preservative. So not going to have a huge impact on the supply in the US, but still just concerning that they made this recommendation without any really being based in any significant evidence. And then a lot of the vaccine supply throughout the rest of the world are still multi-dose vials, so kind of propagating this concern could cause problems elsewhere, where it is very important to use thimerosal in multi-dose vials to keep vaccines safe. Next slide. And finally, I just wanted to touch on, I'm sure many of you have also heard about the MMRV vaccine recommendations that they also discussed at this last meeting. in September. So essentially, they for their recommendations of the combined MMR-V vaccine, they recommend it not be given before the age of 4. So typically you get your MMR and your varicella vaccines starting at 12 months to 15 months, and again at 4 to 6 years. But they decided to no longer recommend it for that first dose when it's less than 4 years. Something concerning that happened was that they voted yes on this recommendation. And then usually when there's a recommendation, a schedule change to the CDC's ACIP recommendations, they have to do a VFC resolution where, like, yes, this now applies to the VFC program and what's covered by the Vaccines for Children program. And they voted to not pass it as a VFC resolution. And this is where they said some of the members said they didn't understand what they voted on. So it's concerning that the new ACIP members are not sure what they're voting on at these extremely important meetings that have very broad impacts in programs like Vaccines for Children, which provide no-cost vaccines for children that are on Medicaid, underinsured, which at least in the city of Chicago is about 60% of children receive their vaccines through the VFC program. So the concern was that there is a rare possibility of a child developing a febrile seizure 1 to 2 weeks after MMR immunization dose. So this has always been known. It's always been highlighted in the schedule. We do have VFC trainings to discuss this as an option. You can get the 2 vaccines separate shots at the same time, your MMR and then your varicella. Or if a parent prefers just having 1 shot versus 2 at that encounter, just to make it easier for the child, but then telling them that there is a slight increased risk for a febrile seizure. Febrile seizures are do happen quite a bit for younger children when having a fever. Usually they're simple febrile seizures, and most children recover quickly from febrile seizures and have no lasting effects, and are not going to have seizures or epilepsy for the rest of their life or anything like that. But this recommendation essentially takes that option out of the VFC program, specifically where it used to be a choice for the provider and the parent to decide, do you want to do the combo or do them separately based on this risk. So I did want to highlight that. And then I think I'll pass it off to Jenny. Thank you.
Hi, everyone. Thanks so much for having me. Next slide. I just wanted to give a little bit of an overview of the chapter, since we are a little bit different than the health departments that are on today, but we are the statewide chapter of the National AAP, which is based up in Itasca. And so our goal is to serve pediatricians and pediatric healthcare providers throughout the state of Illinois to help improve the health and well-being of children. Next slide. You can just see here, we'll talk in depth about immunizations today, and clearly a lot of what we do every day, especially now. But we do have a lot of other programs going on, and so always encourage you to visit our website to learn more. We have a lot of resources on a lot of different child health issues, and feel free to access them. Next slide. As was talked about, the American Academy of Pediatrics engaged with their Committee on Infectious Disease to issue vaccine recommendations. Important to note that the AAP has issued vaccine recommendations every year since 1934. They are celebrating their 95th anniversary this year, and so they predate ACIP. So they have long made yearly recommendations through a publication called the Red Book, which is well known in pediatric sphere around infectious disease. And so issuing of a new vaccination schedule or vaccination recommendations is not new. The AAP puts out many probably hundreds of policies each year that are developed through their committee process, which include experts from across pediatrics, but also other stakeholder groups, and then are reviewed and approved by the AAP Board of Directors. So as I said, it wasn't until 1995 that there was really an effort to align the AAP immunization recommendations with the CDC. They have not differed since around 1989, I think is the number, around in terms of timing around vaccinations, but they have continued to do those. And so you can see here that was released in August, and there is a QR code or the URL to go ahead and review that. That will be updated as things change or move, so that is the best place to do that. Also of note is that AAP is no longer participating in any of the ACIP meetings or subcommittees. So in addition to having many pediatrician experts on those committees, they also were a stakeholder that participated in those, and they are no longer doing so. Next slide. So this is the schedule. They have reformatted this to look exactly very similar to the CDC schedule. At this point, the main difference is really around the COVID-19 vaccine, and you can see that here. The main recommendation that differs from ACIP is, next slide, I think if you go to the next slide, it's there too, is that it is recommended for any child under 2 years old. So that includes both a primary series, so the first vaccination series for COVID, as well as any booster series for under 2. As was covered earlier in the presentation, we do know that that continues to be a high-risk age group for hospitalization and severe COVID outcomes. And so that continues to be recommended. In addition, for children over 2, it is the following risk groups that are listed below. And that also includes a parent or guardian who also desires for their child to have a COVID vaccine. I'll also just note here that the issues around exposure to COVID continues to be a conversation, especially for children of healthcare workers or those that work in high-risk settings. So you can see that here that it's covered under persons of household contacts who are also considered high risk for COVID. That's not completely clear in the ACIP recommendations, but very clear in the AAP recommendations. Next slide. The other places Dr. Sloboda was referring to is the difference between the MMR and the MMRV vaccination. So as Dr. Sloboda was discussing, that the MMRV was essentially an option for families under the age of 2 for their first vaccination. So instead of receiving 2 vaccines, one for MMR and one for varicella, that they were able to receive those as a combo vaccine. So in the previous ACIP recommended vaccinations, it allowed for a conversation between the healthcare provider and those parents and guardians of that child to determine whether they should receive 1 or 2 vaccinations with that low risk related to a febrile seizure. What we do know is that that has been removed in the new ACIP guidelines, which means that it will no longer be available for those who are receiving vaccines through the VFC or Medicaid program. But for those that are either private insured or privately insured, that will likely still be an option, as it is recommended for the AAP to continue that option. There are many reasons why families might choose that. They might be going out of town. They might have a hard time getting to the doctor. Their children might not like being vaccinated, if anyone who's been with their child through that. So that continues to be part of the AAP recommendations as well. And then the MMRV dose for those at 4 continues to be the same, both for AAP as well as ACIP. Next slide. So these difference in schedules have, of course, led to a lot of confusion. And so, you know, the first big area, of course, is around around insurance coverage. So this continues to be something that the AAP and the chapter have been working on for this year in relation to private insurance coverage. So AAP has seen, and there has been information issued from the Insurance Provider Association stating that they'll continue to cover vaccines that were part of the ACIP schedule in December of 2024 through the end of 2026. However, that will not be the same for VFC. So the VFC program, which is the Medicaid program for children to receive vaccinations, is directly tied to ACIP. So we will continue to see a split in availability of those two items. Also, as we were talking about, just general availability. So the able to access vaccines. We are very used to getting our COVID vaccines in pharmacy coming through and out of the pandemic. That's become a little bit more complicated for children, as especially the large pharmacy groups continue to interpret both state and federal guidance around that, as well as the difference between Moderna and Pfizer. So the Pfizer vaccine approval was pulled for that under for those under 2. And so there are some places that might have only had Pfizer and now don't have Moderna for young kids, and so are in the process of getting that. So we continue to see delays in providers as well as pharmacies being able to access, especially COVID vaccine. Again, this issue around liability, we all know that this continues to be somewhat of an off-label use, continued of what is approved by the FDA. Pediatricians are very used to using FDA-approved medications off-label. Most medications are not, don't necessarily go through the approval process for children. So there are certainly concerns around if they would have liability about providing vaccines, because that is kind of a different, separate liability system. Quality measures, the school and child care setting. So really all of this is doing is making a lot of confusion for everyone. I know that the healthcare providers and clinicians are really focusing in on their professional associations, but certainly the fire hose of information that's coming at everybody, and especially those who don't look at this space every day, has been very confusing. Next slide. So these are just some resources to help everyone kind of get up to speed as to what's going on. AAP has been working very hard through their parent-facing portal known as healthychildren.org to be able to provide a lot of great vaccine information and easily digestible, low literacy, very easy to understand information. So we always strongly encourage everyone to go to healthychildren.org. I go there all the time as well to look for information. It's just a really great summary of the AAP and their recommendations around a lot of different health issues, but especially around vaccinations. It is also available in Spanish. They also have many materials that you can pass out at your clinics to give information. AAP has also launched something called Fact Checked. I just encourage everyone to Google everything that is on the AAP site to find it, but Fact Checked is a new service that AAP has launched in the last few months that really focuses in on the various parts of misinformation on health. There's, of course, a lot of information around vaccinations on there, but anytime kind of something pops up in the news, you generally see some sort of fact-checked article related to that. It's a really great place to go to when you start hearing, different things about vaccines or different health issues, to go and see what the AAP and other healthcare professional associations really say and what the research really says about that issue. And so you can find that there. And then, of course, our website, and there's a QR code that you can scan. We're always updating information and putting things together. If there's a resource you're looking for a family or for something specific, always just reach out and let us know. We're working hard to create things, and so we're always looking to fill in those gaps of places where people need more information. And then, of course, making sure that you're following good social media that is rooted in science. And so those are those 3 social media handles as well. Next slide. This is also a lot of great info. So the one great thing that we've seen is a lot of people stepping up to make sure that they're providing great information to families and clinicians around immunization. So if you don't want to go to the AAP, or God forbid you're looking for information that's not related to children, these are all great resources to go to. Lots of new information coming out, lots of places to get involved with many of these organizations for families and individuals. Of course, with the American Families for Vaccines and Vaccinate Your Family, all great places to get started. Next slide. And then just some tips around talking about vaccines. I think I'm going to guess that if you are on this webinar, you're very interested in pro-vaccination and how we can really start to have better conversations about that. So one thing to think about, we all spend a lot of time on our various favorite social media platform, is to make sure that you're amplifying good messages that are rooted in science and research. This doesn't mean that you have to put your Facebook page to public and do all that information, but even just making sure that your friends and family are aware of resources that are really based in, the science that's coming out and not kind of that misinformation. The hardest thing here is there's a lot of information, a lot of research going on how the best ways to talk about vaccines. And really, it's about promoting a positive message. So instead of restating information that might not be correct, we really want to be using words and phrases that open up for a conversation. And so using things like misinformation or disinformation, but really just being open to the positive aspects around vaccines, both for individuals as well as community. And so really just making sure that your messages are positive. If you happen to be in a position that makes flyers or information about immunizations, we always encourage you to use good pro-vaccine messaging. Don't use a scary needle, use a nice Band-Aid, show happy children. Most people are pro-vaccine. I think it's important to remember that. They might have questions, they might have concerns, but everybody's concerned about their community and everybody's concerned about their individual child. And so how can we channel that energy into something positive for immunizations? And then, of course, getting vaccinated, just making sure that you yourself are vaccinated too. I think that's my last slide. Okay, turning it back over.
Great, sounds good. So now I'm going to go over some of the state's vaccine policy actions so that you're aware of all of that. Next slide, please. So, as Dr. Sloboda and Jenny have been outlining, a lot of activity has been happening at the federal level, and we have been closely following, and we've been trying to make sure that all of you, our healthcare provider community, our public, are aware of what our thoughts are around the actions that are happening and the actions that the state is doing. So this is just a summary of some of our directors, your colleague letters. And really what we're emphasizing is that there has been a disruption to the usual vetted process. And we are concerned about the deviation from that gold standard, rigorous scientific evaluation and process before making vaccine decisions. So again, something that we have been closely following and reviewing. We've been reviewing all of the data and the information that has been coming out at the federal level to make the best decision for our state of Illinois. Next slide, please. So what happened was we were waiting for the COVID-19 vaccine recommendations because, again, it was unusual this year, right? Usually by the time the FDA approvals came through, we already knew what the recommendations from the ACIP were as they related to who should get the COVID-19 vaccine. We didn't have those recommendations. And so in light of all of that, all of the changing federal policies and the landscape, our Governor Pritzker, issued an executive order in early September. And this was really a statement that we are going to take an all-of-government approach to ensuring that Illinoisans have access to the vaccines that they need for this fall. So this executive order, in addition to laying out that all-of-government vaccine access initiative, so making sure our different state agencies, whether it's our Department of Public Health, our state agency overseeing Medicaid, so HFS, the Department of Insurance, and all of our other partners who make sure that our communities are safe. He also issued in his executive order an order that our health department issue a standing order within 15 days of this executive order for any vaccines that Illinoisans may need this fall. Also made sure that we were thinking about contingency planning, insurance coverage, which I know has been really top of mind for many people, vaccine supply, all that, and making sure that we're also doing outreach and education in a way that is understandable, meaningful to Illinois communities out there. Next slide. So in addition to this executive order, we had already planned for our own Illinois Immunization Advisory Committee to meet and give recommendations on the COVID vaccine and any other fall respiratory virus vaccines. So what is the Illinois Immunization Advisory Committee? So this is essentially our board of vaccine experts. And this is a committee that's been around for some time. It was created by statute. But we recently, in light of everything that was happening at the federal level, the changes to the ACIP, we decided that we really wanted to make sure that our advisory committee was ready, that it was in place, and that it had a wide variety of individuals with expertise in vaccines, vaccinations, and the communities who receive vaccines or give vaccines. So currently, our Immunization Advisory Committee has 20 members. We have no vacancies, which we're really pleased with. We filled all of the positions. And again, this is a body that provides recommendations to the director of IDPH. And then our director and our team here take all of those expert recommendations in mind as we issue our own IDPH recommendations around immunizations. So again, I've been so impressed with the level of expertise on this committee. So experts in pediatrics, family medicine, internal medicine, obstetrics and gynecology, infectious diseases, of course, nursing, pharmacy, public health practice, epidemiology. So all of the different fields, all of the different considerations that need to be in place when a public health department like ours puts out recommendations for vaccinations. So our Immunization Advisory Committee convened in September, right after the ACIP meeting, to review the data that was presented there, the recommendations that came out of that meeting. Also, they reviewed many different studies on vaccine safety, efficacy, and we reviewed the epidemiology of who was being affected by flu, RSV, COVID-19, and then they issued, they provided recommendations to our health department on who should get each of these vaccines. So next slide, please. So what did they say? And if you could go back just to one prior slide, please. Yeah, so I'm going to focus on COVID-19. So they reviewed all of the data and the recommendations regarding flu for everyone 6 months and older and agreed with that, so that everyone in our state who is 6 months of age and older should get the flu vaccine. Recommendations for the RSV immunization for our infants and for pregnant people and for older adults, those aligned with what the CDC and ACIP had said previously in terms of who should receive those. So I'm going to focus on COVID-19 vaccinations. So one other body of information, data, recommendations that I didn't mention before is that our Immunization Advisory Committee, our health department, also reviewed all of the professional medical society recommendations and guidelines that came out. So that includes the recommendations that were issued by the American Academy of Pediatrics, that were issued by the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists. So all of the guidelines out there, all of the data were reviewed to come up with these recommendations. And essentially these align with the recommendations that you may have heard from our medical specialty societies. So for COVID-19 vaccination for children, all children ages 6 through 23 months should get the vaccine. And this is, again, as I mentioned earlier, because we saw high hospitalization rates in this age group in particular. And then for children ages 2 years through 17 years, if they have one of the following risk categories, they should get vaccinated. So people who have a high risk of severe COVID-19 because they have some kind of underlying medical condition, residents who are in congregate settings like long-term care facilities or group homes, they should get vaccinated. People who have never been vaccinated should get vaccinated. And those who have household contacts who are at higher risk for severe COVID-19. And then for those children ages 2 to 17 years who don't have one of those risk categories, if their parent or guardian desires their protection from COVID-19, they should also get the vaccine. For pregnant people, all individuals or will be pregnant during any trimester of pregnancy, and in the postpartum stage, and also during lactation, they are also recommended to get vaccinated. This is because those children under 6 months of age, this is their only option for protection through vaccination if their mother is vaccinated. And so really, really important. We saw really high hospitalization rates across the country for that particular age group. So another reason why, in addition to protecting the pregnant person against severe COVID-19 outcomes. And then for adults, all adults ages 18 years and older are recommended to get vaccinated. We know that, for children, many children don't have an underlying risk factor who were hospitalized with COVID-19. For adults, it's a different story. Most adults actually have an underlying condition. And for those of you who take care of adults, you also know that there are many adults who don't have easy access to healthcare. They might not realize that they have an underlying condition. So this is a universal recommendation for all adults ages 18 years and older to get the COVID-19 vaccine. Next slide, please. And so we reviewed the recommendations that our Immunization Advisory Committee gave to our director. We reviewed all of the medical society recommendations, what ACIP had put out, all of the data again, and we adopted the recommendations that our Immunization Advisory Committee had recommended. So we released these at the end of September. You can go to our website, dph.illinois.gov/immunization. It lays out all of the different guidance for all of the respiratory virus vaccines. And then in terms of other routine child and adult immunizations, because we were also getting questions about that, we are referring, and we actually have the actual schedules on our website, we're referring people to use the schedules that were updated by CDC at the beginning of August, because that also incorporated some of the recommendations, the newer recommendations, for example, around RSV for adults 50 to 74 years, so lowering that age group for those who have an increased risk of severe RSV disease, some of the recommendations that came out of the April ACIP meeting. So for the routine immunizations, no changes from what was in place before, and then we issued these respiratory virus season guidelines. And so in terms of next steps, and I know that we're going to get into this a little bit more, and this is what a lot of people have been focused on, as we all should be, is how do we then make sure with these guidelines in place that individuals are able to access and get these vaccines? So we've been working really hard with our healthcare partners like ICAP, our local health departments, pharmacies, to really get a sense of where are the vaccines right now? What are people's plans in terms of our usual vaccine providers? What are our challenges, barriers that our state health department could help with? So again, it's an all hands on deck approach, and we have just been really, really thankful for all of the important partnerships that our state health department has had. So I believe I'm going to pass it back over to Dr. Sloboda.
All right, thank you. And yeah, I'll just touch briefly a bit about what we've been doing here at CDPH in the city of Chicago. Like we've all talked about, there's been a lot of confusion, a lot of different recommendations coming from different entities, and particularly around those from the federal government, since those directly impact the Vaccines for Children program. We've really wanted to make sure our 300 plus Chicago VFC providers are up to date about these changes, but really what do they need for the Vaccines for Children program? So we're still learning more every day as the changes take effect for the VFC program. We saw there was a delay in VFC COVID-19 vaccines. Thankfully, those are now available since last week for ordering for VFC providers. But just doing our monthly newsletters, but also some special newsletters as well for any breaking news. But it's really important to make sure the Vaccines for Children program is essential for the entire country, but particularly as well for Illinois and the city of Chicago. And this is how we ensure that there's vaccine access and equity so that all children, regardless of their insurance status or social determinants of health, have access to vaccines. So that's one of our main concerns right now. And like I talked about, ACIP recommendations directly impact the VFC program. So that's why we're watching these very closely and how these changes impact the program. We've gotten a lot of support from ICAP in creating these newsletters and informing providers. But we've been keeping Chicago providers updated as well, sharing the siren and colleague letters from IDPH, as well as other hot alerts, and doing webinars and more. So all Chicago providers can try to navigate this new landscape. Next slide. So in terms of flu and COVID vaccine access, we get a lot of inquiries and a lot of concern about this in Chicago, which is very understandable. CDPH does endorse the Illinois Immunization Advisory Committee and IDPH's fall vaccine recommendations. We at CDPH are providing no-cost flu and COVID-19 vaccine to all Chicago residents 6 months and older. We have 4 immunization walk-in clinics throughout the city, in Uptown, Greater Lawn, Pilsen, Roseland. But we also have a variety of community vaccination and pop-up events throughout the city. Our biggest ones are at city colleges starting this weekend at Kennedy Kane that go throughout the fall every Saturday. It's kind of the bigger events where people can come to get vaccinated. We do encourage people with insurance, if they're able to go to a pharmacy or provider to get vaccinated, that would be appreciated. But for people that find any sort of barriers, they can always come to CDPH to get their updated flu and COVID vaccines. Next slide. The biggest thing right now, in addition to keeping our healthcare partners and providers up to date, is really, and things we've always been doing throughout, before COVID, during all sorts of vaccine-preventable disease outbreaks, is partnering with CBOs, faith-based organizations, and trusted messengers, which is now more important now than ever with all the misinformation, confusion going around, and making sure we're giving clear, understandable, relatable messages and guidance to Chicagoans. We're doing a variety of in-person vaccine education and outreach. We go to community-based organizations, shelters, daycares, schools, other community settings. We have public health nurses that are on the ground talking to people, answering their questions, a lot of concerns. And that's really how the best way and is the most resource and time intensive, but in person-to-person interaction, talking to people, answering their questions does go the furthest. We still have our Healthy Chicago 2025 initiative, which looks to address the life expectancy gap between Black and non-Black Chicagoans. And a big part of that is working in community areas on the west and south side that have been most impacted by flu and COVID, making sure that they are getting information, outreach, education, events, engaging with partners there to either maintain or hopefully improve uptake of flu and COVID vaccine. Like I said, working on information that's understandable, relatable, pretty straightforward, just working to answer people's questions. Slide. Even outside of flu and COVID, we've already been throughout this year, obviously MMR vaccine has been a big topic just because of the significant measles number of cases and outbreaks in the United States this year, more cases in the US in 2025 than over 3 decades since the early 90s, which is concerning. So obviously a lot of people have questions and concerns about MMR vaccine. We provide those at our clinics and events. We have the VFC vaccines for children that are eligible. We have adult vaccines for uninsured adults, but we also have MMR as well as Mpox vaccine to all Chicago residents at no cost clinics. We've also been really focusing on outreaching to immigrant and refugee communities in Chicago, particularly around measles, MMR vaccine, and routine childhood vaccinations. We try to get information to parents, particularly if they're not comfortable in English or English as a second language, trying to get them information in a language that they're comfortable with, and getting those materials translated, working closely with CPS on that. But we have seen that certain immigrant and refugee communities are targeted with misinformation by anti-vax groups. So we're trying to make sure we reach out to CBOs and immigrant refugee communities to try to meet with them, answer their questions, get them correct information about vaccines. And we're also fortunately having a Mpox outbreak in the city of Chicago right now as well. So the department and all of our partners are doing a lot of outreach, education, vaccination for Mpox right now as well. Next slide. That's it. Thank you.
Okay, thank you all so much for your very informative presentations. We're going to jump into the question and answer portion of this webinar. And we're going to start with questions that were submitted when you registered for the webinar. We're going to start with, and I think this is a very relevant question, how can we prove vaccines do not cause autism, especially with rising diagnosis in children?
Should I start with that, and then I can give the stage to any of my colleagues who want to chime in? But there have been multiple studies that have refuted that claim. Multiple studies. It's been studied for years, actually. And so I think that just making sure that there's accurate information out there is so important. And the good thing is that we have been able to identify autism earlier, and more people who need services and support because of improvements in our screening processes. And so I think there's a lot of information that's being put out there. But one thing that we know is that study after study over the years have not shown that vaccines cause autism or anything like that. So I don't know if Jenny or Dr. Sloboda want to chime in with additional insights.
Yeah, just to go off of that, like Dr. Suh said, it's one of the most studied topics in public health for decades now. There's been studies that look at hundreds of thousands, if not millions of children, and have not shown any link or causation between vaccines and autism. There's still a lot to learn about autism, but from what we know, it is something that starts to develop during pregnancy. And there are various risk factors that have been found in terms of different parental risk factors, parental age, prematurity, and risk factors like that that definitely need to be studied more. But in terms of vaccines, I think it's pretty clear from the evidence looking at all the children that have received vaccines throughout the world. A lot of these studies look at other countries in the US and Europe, other countries as well, show that there is no link. And I think the main thing is like, yeah, they've been seeing this kind of increase in diagnoses of autism, and a lot of that comes from where more providers are more aware, more well-trained, are able to identify autism, get children and families the support they need. It's also a spectrum. Autism is a very diverse experience. People experience autism in very different ways, have very different experiences and symptoms. And so just to group them all as one thing, that it's a bad thing, is not very helpful. I think it's more important to support people with autism and their families and get them the supportive services they need, and trying to like blame vaccines for this. Obviously, families and parents want answers for why things happen, which is very understandable. So there are some things we know. There's a lot of things we don't know yet. But the things we do know is that vaccines, and Tylenol for that matter, do not cause autism.
Okay, thank you so much. I guess this next question kind of goes along with the first one, but can any of you speak to, how can we talk to patients and parents to refute the narrative that vaccines aren't safe? Jenny, you touched on this a little bit in your presentation.
Yeah, I can certainly jump in. As if it's coming from a clinician, so there is lots of education efforts going on both by the chapter as well as AAP in terms of talking a lot about how to have those conversations with families. Much of really what comes down to that conversation is really just having the time to ask and answer those questions. I think there are a lot of answers to these questions that people come up. You can certainly find a lot of those on healthychildren.org, as well as the AAP Fact Check really goes into specifics in terms of some of that information that's been coming out as well. So, just having the time to be able to answer those questions and being patient and meeting people where they are.
Yeah, I think that point about meeting people where they are is so important. So just really listening and hearing out people's concerns, because it can be scary if you don't really know what a vaccine is or this is your first child, right? And so just really listening, starting from what are the concerns, and then addressing with accurate information and providing the resources that people need to make that decision. And I think we're realizing that this is an ongoing conversation. So just continuing to plant the seeds of accurate information with each encounter with a patient, if you're in patient care, or your clients for those out in the community, I think it's very important.
Great, thank you so much. Given what's happening at the federal level and the CDC and the FDA, could there be an impact to the quality or safety of the vaccines?
Well, right now, so there's a very rigorous multi-tiered vaccine safety monitoring system that is in place. Now, we're, of course, closely watching what's happening at the federal level. Those are important systems, and they require a lot of resources. So we'll continue to advocate for ensuring that those systems are in place. But, in addition to those systems, each of the manufacturers of the vaccines, they also continue to look for any safety signals as well. So again, multiple tiers of monitoring to ensure vaccines are safe. So again, it's a system that's in place, like many other systems at the federal level, so important, and something that we're closely watching, I think, together as state health departments, local health departments, just people who live in this country as to what's going to happen with that. But right now, that system is still in place. So I'm not sure if others want to chime in with any insights.
Yeah, just to add to that, vaccine safety sits in two different agencies. So it's important to remember that vaccines also go through a rigorous FDA approval process, as well as going through the CDC, who then makes recommendations about when those vaccines should be provided. So there's so many layers to the vaccine system in terms of monitoring safety, monitoring, the best time to provide those vaccines to children to get the maximum preventiveness, all of those types of things. There's many different agencies working together for that.
Great, thank you so much. We do have a lot of people who work in the education system on this webinar in Illinois, and we had a question come in regarding high school students who live in the south suburbs and where they can receive vaccines, especially for free if they have insurance or their insurance won't cover the cost.
So is this the south suburbs of
Yes.
Chicago? So Cook County? Well,
Yeah.
I think the first place to start. So for those children, they are eligible for Vaccines for Children vaccines. So they could start with their local health departments, many federally qualified health centers, VFC providers. What I can do is, or maybe we can share it out afterwards, there is a site that IDPH has with vaccine. You can find a vaccine provider that provides vaccines for children vaccines. But I think a great place to start is with a local health department or a federally qualified health center to access those VFC vaccines.
Great, thank you. One question we received was, how can we raise awareness about vaccine safety, especially in this current political climate? Speak a little bit to maybe how someone could approach that.
I'll start. You can jump in. Yeah, I mean, I much of what we see here now in 2025 is information that's spread through what I'm going to call alternative news sources. So really social media, friends and family, those types of things. So in the same way, when we were talking about conversations happening on the clinician side, also just being open to those conversations, with your friends and family. We often talk about social media and the effect that that has, whether it's TikTok or I'm an Instagram person, but I know a lot of people are TikTok people, and it's very easy to get lost in that algorithm. We all have those stories about suddenly we're only seeing information on this. So really important too, to just be able to amplify, even with amongst your friends and family, really good resources. So as we talked about with the health departments, with the various professional societies, healthychildren.org, they actually have a whole list of pediatricians that are really great sources of information to follow, and just retweeting them, or whatever phrase we're using now, reposting them to every time you do that, every time you like something, every time you save something, every time you repost something, that tweaks the algorithm so that that gets more views and more information. So part of it is just to recognize that we live in a really different information system than we ever have before. And we do have control over it at the end of the day. We can like things, we can follow things, we can unfollow things. And so making sure that, the information that you do share is credible. If you see something that looks strange, maybe pausing and making sure that it's okay. IDPH just had a really great post a couple days ago about how to recognize good information and how to recognize bad information. And it's just a great reminder that it's really easy when we're all scrolling to, tweet or retweet something that sounds interesting, but just taking a second and making sure it's accurate and that you yourself are a good source of information.
Thank you so much, Jenny. Another question, kind of related to the safety of vaccines. What do you tell parents about the aluminum and formaldehyde that's in vaccines, which are known neurotoxins?
Yeah, I mean, so first of all, I make sure that the vaccine that we're talking about actually has any of that. And they're in such small amounts. And for many of these things, they're actually found naturally in food that we eat or in other sources. So really making that comparison, I still recall a family. It was like new parents. They brought in their baby and they were thinking about getting their shots. And the aluminum question came up. And we just took some time to talk and compare, some of this is found in food, and the amount that's found here is much less than what's found here, in like what's found in a food source. So you're exposed to a lot of these every day, and we know that they haven't had any kind of safety effects, again, because we have a very rigorous vaccine safety monitoring system. So that's how I approach it, just kind of that comparison, making sure people have accurate information of what these are, and if there's a difference, this is the Marisol is different, but like the mercury that the Marisol is completely different from the mercury, like the toxic mercury that everyone thinks about. And so little differences there, I think, is so important. This just really goes back to what Jenny was saying, making sure everyone has important and accurate information, and that we are all sources of accurate information.
Great, thank you. And I think we'll wrap up with one more question. Do states have the power to reject federal immunization guidelines?
So none of those guidelines are requirements, right? The CDC recommendations are recommendations. They're not a mandate for anyone. And each state, as you've seen, we can issue our own guidelines based on what we think is best for our state. Now, that being said, there are other implications. Many insurance laws are tied, as was mentioned before, to the CDC and ACIP recommendations. So mandates under the Affordable Care Act to cover immunizations at no cost, that relies on that ACIP recommendation. Medicaid, Medicare coverage can rely on the ACIP recommendations too. But in terms of what a state can do, you've seen already that many states across the country, including Illinois, have decided to put out different guidance than what the federal government says. So yeah, I guess to that is no, we don't have to, but we think about the implications of it. Because again, we don't want piecemeal 50 different recommendations at each state coming out of each state either. It's confusing for families. We don't have walls around each of our state borders. We travel, we have family in other places, people work in different areas, and we want to have a unified approach too, because we want to make sure accurate information is getting out, that everyone has access to the vaccines they need. I'll turn it over to Jenny for any additional thoughts.
No, I was just going to say, I think that's just a continued source of confusion, that the CDC does not mandate vaccines for anyone. They make recommendations, and then according to federal law, those recommendations have to be followed by either private insurance plans through the ACA or through Medicaid and Medicare through like the VFC program. So anytime we're talking about vaccine, quote unquote mandates, we're really talking about that in terms of a school setting. So places where children gather, and diseases, as anyone who has kids know, especially this time of year, spread very easily by a cold. And so for those very highly contagious diseases, such as measles, such as pertussis, those are places where schools have long held that it's to have mandates, not only to protect disease, but also to protect children who cannot be vaccinated. So for children who might have conditions where they just don't respond to vaccines, or to have, cancer conditions or different various medical conditions where they actually have medical exemptions. So that we're creating a community where everyone can attend school and be safe and healthy.
Wonderful. Thank you so much. We're just getting to the end of the webinar. I want to thank you again for joining us and sharing your expertise on this very timely and important topic, especially as we get into the winter months. Before we fully wrap up, I do just want to go over a couple of upcoming events and opportunities with you. So the first is on November 20th, 2025, RHA is hosting our Living Better Together conference. It's an opportunity for people with COPD or other chronic lung diseases to come together and hear from healthcare experts to help them better manage their conditions. So you can visit our website to learn more, to register. I also want to mention our Hustle Chicago Stair Climb, which is coming up again on February 22nd, 2026. It's really fun. I did it last year. It's a great workout. But if you want to raise funds for RHA and help people, with lung disease and promote clean air, come join us. Again, you can visit our website for more information. I also want to share that the Illinois Department of Public Health is hosting a webinar on October 16th, so this Thursday. And it's a series of clinician-directed interactive info sessions in an office hours kind of format that's targeted towards raising timely awareness of emerging and high-impact public health issues that directly involve clinical care or health system considerations. And lastly, RHA advocates champion sound public health policy by engaging directly with lawmakers through things like legislative visits, hearing testimony, actions alerts, and outreach like phone calls and emails. These efforts help us to amplify the voices of those affected by lung disease and help us to shape policies to protect lung health and promote clean air. And we're always looking to engage new advocates. So if you're interested in becoming an advocate or learning more, again, you can visit our website for more information. And, if you're able, please consider making a donation to RHA. Programs like today's webinar are supported by our donors. We would not be able to adapt and respond to public health threats and the needs of our community without your support. So if you're able, please consider so that we can, continue to bring these wonderful and informative webinars to you all. So I think that about wraps it up. Thank you everyone for joining us today, and we hope you learned something, and have a safe, healthy fall, winter. Thank you so much.